The nation's top doctor says gun violence in America is a public health crisis, even for people who aren't directly involved in a shooting.
And today, the Surgeon General took steps to address the concern. Natalie Brand has more details from Washington, D.C.
Scenes like this one earlier this month, a shooting at a Michigan splash park that wounded 9 people, including 2 children, have prompted the U.S. Surgeon General to declare gun violence a public health crisis.
My hope is that if we understand this as a kids issue, that we will raise it on the priority list, that we will see it not as a political issue, but as a public health issue that should concern all of us.
A landmark advisory from Dr. Vivek Murthy sounds the alarm that gun violence is now the leading cause of death for children and teens. And more than half of adults say they or a family member have experienced a gun-related incident.
We don't have to live like this, and I lay out a series of strategies in this advisory that can help us reduce the profound toll of gun violence and help recognize that this is an issue that's infiltrated the psyche of America.
The 40-page document calls for solutions from stricter gun laws, including a ban on assault weapons, to community involvement, even talking about safe gun storage at the doctor's office. The NRA says the answer is to prosecute criminals and not restrict gun rights.
Does something need to change with respect to laws that help keep people safe from gun violence?
Sure. I think that there needs to be a bigger focus on giving DAs and prosecutors the tools they need to put dangerous criminals where they belong, and that's in jail, behind bars.
The Surgeon General says gun violence is also taking a toll on mental health. He says nearly 80% of adult Americans stress about the possibility of a mass shooting, and half of all high school-age kids worry about a shooting in their school. Natalie Brand, CBS News, Washington.